now. So basically, what we have to start with the introduction part. In the introduction, then we do write down the body of the letter and then conclusion. So today's class we will discuss about the body and conclusion. So let's say normally in the letter we have 2 to 3 body paragraph. So first of all, in the introduction, as we discussed in the previous lectures, that we just discussed about the reason of writing. That why are you writing this letter? Clearly, you have to mention if it's a referral letter. So if they have some assessment and further line of action, such as further investigation, let's say treatment, or so on. So in 2 to 3 minutes time, we can see there. Sorry, 2 to 3 paragraph actually. We have reason of writing in the introduction, then the body of the letter. We have 3 paragraph maybe. We can discuss what we can write it down, and then at the end we will write conclusion. So let's say symmetry of the structure of the paragraph I'm going to discuss with you. Now, normally it's been discussed that we have to write it down, let's say around 30 words maximum, but case dependent on the introduction. Then we can see there, body 1, we have, let's say, if it's a conventional pattern, and if you have to write down social history or past medical history, if it's relevant. I'm not suggesting you to write past medical history and social history always in the second paragraph, like the body 1, but if it's relevant, and if you are writing over here, so try to compose it in maximum of 40 to 45 words, maximum of, right? Then the body 2, if you are writing the body 2, what would you write it down in the body 2 if the summary or overview, like we can just summarize the first few visits if it's a referral letter. Okay, in case of referral letter, let's say if you have 4 visits, so the first 2 to 3 visits we do have the chronic symptom, or it's leading from chronic to acute. We have mild symptom, so we have to summarize this part in the body 2, and then we can write down about the, let's say, body 3. Normally, if it's a progression of problem, if the disease is progressing time by time, and this is the same problems going on, so body 3 we write it down about the today's paragraph, most important detail, right? So here we have to write it down like 70 to 80 words maximum in the body paragraph. And then similarly, conclusion should be written with the 25 to 30 words. But the sequence of the paragraph depends upon the case. There could be a scenario, let's say, there could be a scenario when you have to write it down, maybe the social history or the past medical history after today visit before conclusion, as this is not that much important. So you can start maybe from this paragraph, or in case of emergency referral, we can see that even if it's the progressive disease, we prefer to bring like today's over here, and then we can start for like body 2, like overview of the problem, and then write the social plus medical history. Sometime we can combine it with that. So structuring of the body or the organization of the letter depends upon the importance of the case, right? As we go on and practice multiple letters in the class, we would learn about the organization. It cannot be taught in single lecture that how would you organize the letter, though we can make some, like ideal structure in our mind that would be applicable for some of the cases, but it cannot be appropriate for all letters. For that reason, we would suggest our students that you have to, like organize as per the importance of the case notes. There is no standard structure. A funny but a most frequent question the student asks from us when we go for the feedback. They will always ask from us that when we do understand, okay, we have to write down social history up above, you mark us to write it below, and we write it below, you mark us to write it above. So this is something funny, but for understanding perspective, you have to understand that social plus past medical history can be written at a place where it is more appropriate. So I would try to crack this thing down in simple way, like social history or past medical history. Let's say you have to understand the gravity of this information. If I'm writing the social history or past medical history, so I would see about the gravity. Like if it's a referral letter, let's say if it's a referral letter, so I would see that this social history first, like how much it is important to make the diagnosis, confirm diagnosis, because we are a GP, we cannot make the confirmed diagnosis. Then similarly, is past medical history, how much it will be a contributing factor first of all in the diagnosis, because mostly social history or the past medical history is the risk factor for that problem. Number one. Number second thing is how much it will contribute in the management of the disease, right? So according to that, we have to organize the information. Okay, clear to you? Anyhow, so moving on toward the body paragraph, that is the agenda of today's class. So let's say in any of the body paragraph, the structure of the paragraph we can discuss. So ideally speaking, the paragraph has three parts. The first part of the paragraph, we do have the main idea, or in linguistic we do say it's a topic sentence. The main idea or the topic sentence. So what is the main idea or the topic sentence is to bring it down the main reason of presentation at that time, or it could be our view of maybe the problem, any presenting complaint, let's say chest pain and so on. It could be our view, but it's something that we can write in one word or in a sentence, right? That will introduce the recipient the main reason of writing or the main idea of the paragraph that will be further explained, right? So in the short word, the first line will be about the topic sentence that will covers the main idea. Afterward, we have to expand that with the help of supporting sentences. So in terms of supporting sentences, it may contain information regarding maybe patient history, regarding the problem. It could also be depression, sorry, not depression. It could also be, you can say, symptoms, description of the symptoms. We can also have the treatment record in this part, effects and side effects, like cause and effects over here, can be written in this part. Remember that these all information will be written in the case notes. So you have to transform. You have to transform. Do not use the word that is being written in the case notes. What I mean by that, let's say if we have, let's say, a word such as, let's say, complain. This is basically a verb. If it is something that has been written in the case notes, so you have to change it to complained, right? A noun. So this is your skill that you have to show. First of all, you have to change the word if you can, rather than writing the same word again. Similarly, if you can see, we have the word such as lethargy. You can change it to lethargic if you get the word. And even, like if you can see, we have the, tiredness word, let's say, in the case notes, we can write it down back to the lethargic. If we have the word tiredness or lethargic, we can write it down back to fatigue. So, using the synonyms, using the synonyms is also appreciated. You have to use the synonym as well, right? So, in simple word, the body of the paragraph will be testing, apart from the sequence of the information that you write it down, will be testing your paraphrasing skills. Would you be able to paraphrase it or not? So, paraphrasing has to be done. It's important skills that you must paraphrase the information, right? And the third part is the signal words or the cohesive devices. So, what are the signal words? These are the connectors. So, you must master yourself in development of connectors and the use of connectors in the sentence. So, we have few things in the OET that would be helpful for you. For time, normally we can use at the time of admission, let's say. These are the clauses you can use in this part that will show you clarity in the structure. Maybe on review after 2 days, rather than writing date again. You can see that most of the candidates just write date time and again, like 2, 11, 12 on this date, then they will write on 4, 11, 12. So you can replace this thing with the on review after 2 days. Okay. And similarly, rather than writing just today, we can also change it to the, I'm not saying it's wrong, but you can write it down on consultation today, if in case of referral letter, right? So similarly, after before sorry, moving on, today can be replaced with recently as well. Okay, and for the time marker, when you have to summarize something for 2 to 3 period of time, like for visits, you can write it down over the past 3 months or 3 weeks. Let's say he presented with mild chest pain, or let's say 2 days later, as we discussed earlier, if you are discussing something on her next visit, okay, initial examination and so on, right? When we have to add something, more information, what we can do in this case, the preference is to write it down, let's say in addition, when you are adding the information, right? We can also use also, we can also use apart from this when we are adding the information, okay? But there are some connectors that you have not to use as per the recent guideline, which include moreover and furthermore. We should not use them, right? So moreover and furthermore should not be used. Rest of the connectors for adding the information has to be used. Okay. Anyhow, so moving on toward the let's say when we have to have contrast, when we have to have contrast like between two information, we can use few words such as despite. We can use in spite of. We can use however. We can use even though. Okay, we can use although, where, while, whereas. Now, these are the signal markers. Then we have to have a contrast between two things. We can use those things. Tomorrow, inshallah, in class, we will be discussing about how to write down the different clauses in the grammar class. But just to give you a brief idea about that. Similarly, when we have to emphasize in the paragraph, so we can use some certain statement. Let's say, please note that, right? It is important to mention. Let's say, okay, it is important to mention. Please note that, or uh, you can also write it down. I am concerned about, let's say, what concern most is. So few statement can be used to uh, show some emphasis in here. Some subjective changes, some subjective lines can be used, let's say, in term of her or his medical history in term of social history, right? We can use these few words, okay? And for advice, when you have to provide advice, so you can use, let's say, it is important to modify your diet. Let's say now you are giving advice to the patient. Similarly, I recommend, let's say, dietary advice, or please ensure his or her medicine compliance. And when we have to sequence the information, we can use firstly, secondly, and thirdly, right? And so on. So these are the signal markers. Let's see if I'm going to write some introduction, some paragraph, like for your understanding, just half cooked. Let's say initially, or maybe not initially, we can write it down 3 weeks back. If it's from today's visit, whatever, you can also continue from initially and from 3 weeks back. He presented to my clinic with 2 days history of abdominal pain. 3 weeks back, he presented to my clinic with 2 days history of abdominal pain. Let's say. Now, as I mentioned that in the topic sentence, we have to cover this thing up. So here, we know that right now this paragraph will be about something related to abdominal pain or GI symptom. Okay. So then we can write it down. If we have some other complaints, we can also write beside that he was also having. We'll explain everything, right? Then we can write it down on examination. The next sequence, put comma, whatever you found. Then, if we have some advice, for example, medicine, or if you have done some investigation, normally you write down the medicine, let's say. Therefore, blah blah medicine was advised, right? Let's say, however, he presented again with worsening of blah blah. Therefore, blah blah medicine was changed and blah blah test was recommended. Let's say. So this is a sequence of your paragraph. We can write it down 3 weeks back. He presented to my clinic with 2 day history of abdominal pain. Besides that, he was also having blah blah issue. On examination, we have find something in examination. Then we can also change this paragraph as well. Despite being managed with blah blah medication, his symptom did not settle, and he reported after 2 days that he was having worsening of he presented again with worsening increased pain. Therefore, blah blah medicine was changed to blah, and he was advised to go for blah blah test. Let's say CT scan or whatever. So this is the sequence of the paragraph can be followed. And then the next paragraph, when we start, we can write it down, let's say 2 weeks later. Let's say he presented with the worsening of the same symptoms. Okay, let's say we can write it down. 2 weeks later, he presented with worsening of the same symptoms. Let's say if you have ordered the ultrasound result ordered on last visit, revealed, whatever. Then we can write it down, let's say conclusion part and so on. Anyhow, so this is something we discuss about the body paragraph. Now we can see that writing conclusion, normally after writing the today's paragraph, we can write down the conclusion. In conclusion part, There are few things that you must include in the conclusion, and this is the most again frequently asked question by the student, that they ask the question that should we write it again like we have mentioned in the introduction. So answer to this question is yes, we have to summarize it again, but you must work on the language part, like you not repeat the language time and again. Okay. Most important thing, even we can start from before we can write it down the conclusion, that you have to make sure in order to organize your letter, in order to present your letter in more appropriate manner, that always plan your letter while standing on the current situation or today's visit. Either it's a discharge letter or it's a referral letter or request letter. Always plan your letter from today's perspective. It does not mean that you should eliminate something important. Do include all the information, even if it's less important, but focus on the current situation. That is more important than anything else. Anyhow, now starting from the conclusion, we have to write it down. Uh, you can say you have to request something of action required, and politely you have to request it. Summary of the issue, summary of the diagnosis, suspected mostly, and thanks for. Let me get add it. Thanks for ongoing support, and then sign off, in which we can write it down future assistance. You can offer future assistance. Okay. So the point of concern is that always keep in mind the reason of writing and try to write in your own language. Do not repeat it again, the same case notes that has been given to you. Right. There are some do's and don'ts in today's class. You have to understand that do not follow the sequence of the notes always. So it's not the case always that you can follow chronological sequence. You must understand the importance or the important case notes. You must understand important case notes, and you have to summarize, as we discussed time and again, the less relevant details so that you can compose the letter. Most importantly, try to have your task in 180 to 200 words. It's something depending upon the selection. If you write plus 220 words above 220, number one, or under 160, it would also impact your case notes. Okay. You have to omit the information not directly related. You have to omit information not directly related. And yes, we have to summarize or lay out your letter that even a layman can understand. It should be so basically it should be written in such way that even a layman can understand that how well presented, how you have presented this letter quite well. So what you can do is you need to understand reading the case notes, and more important thing is to learn grouping. What I mean by that, let's say Mr. Alex, a pack smoker, drinker, if with a family history of diabetes, presented 3 weeks back with 2 weeks history of lethargy. So you can see that in this way, I have just combined the risk factor along with the presenting complaint. This is called grouping. So grouping do mean that you have to write it down the same set of information that is important in one paragraph accordingly, right? So